Hello, my name is Philip Rouleau with Rultract, and today I'm going to show you how to set the retractor up for the minimally invasive CABG procedure. Now, when we set the Rultract up for what we refer to as the McGinn technique, we put the Rultract on the right side of the table because the surgeon is going to be on the left side of the table. You'll take your Rultract table clamp and you'll see the clamp has notches cut out in it. The reason for the notches is it's designed to go around the bolts that hold the rail on the table. Of course, you can also put the clamp in between these bolts, but what you do not want to do is clamp onto one of the bolts. If you hit one of the bolts with the jaws of the clamp, it may not get a good secure purchase on the bed rail. So again, what you want to do is go around a bolt or in between the bolts. Now take your clamp and turn the knob counterclockwise all the way until it stops, being sure that the jaws are open all the way. Now squeeze them and make sure that they move freely. Once you are sure that the jaws are open all the way, go ahead and reach down and feel for the space between the bolts on the OR table bed rail. Also check for any other obstruction. Put the upper jaw on the bed rail, rotate the lower jaw in, and then squeeze the clamp together. And then tighten the knob. What you do not want to do is use the knob to bring the jaws together, because you may not get a uniform grip on the bed rail and the retractor will possibly wobble. So go ahead and bring those two jaws together, hold the jaws closed, and then tighten the knob. Make sure your glove doesn't get stuck here. Tighten that knob as tight as you can get it. Next, you're going to take your bottom post. You can see there's a bend in this post, and this bend is designed to go away from the OR table. What that does is it allows for more space for the patient's shoulder here. So we go ahead and drop that into place and then tighten the wing handle. You are now ready to put the top post onto the bottom post. Now, in placing the top post onto the bottom post, you will notice that this post has notches or splines cut into it. They are designed to allow the top post to be rotated at 18-degree increments. For this procedure, we're going to put the top post onto the bottom post so that it goes straight out across the OR table. If you put it down onto the bottom post and it's angled at 18 degrees one way or the other, lift it up, readjust it, and be sure it's going straight across the table. And then make sure that it's seated properly. You are now ready to put the 6-inch extender bar onto the top post. Turn your lock knob all the way counterclockwise until it stops. Go ahead and slide the extender bar onto the top post all the way, and then turn your lock knob, tightening it down into one of the detents or holes on the top post. Make sure that it's tightened securely. Next, you are going to take your rotating extender bar and put it onto the 6-inch extender bar. Again, turn your lock knob all the way counterclockwise until it stops. Go ahead and place the rotating extender bar onto the 6-inch extender bar. Put it onto its optimum position depending on the surgeon's preference. And then turn your lock knob all the way so it tightens down into a detent or hole on the 6-inch extender bar. Once it's in place, you can loosen the knob on the top, and the rotating extender bar will rotate 360 degrees to allow for optimum position for the Thoratrak. Next, we are going to put the ratchet assembly onto the rotating extender bar. So again, make sure this lock knob is turned counterclockwise all the way until it stops. Now, when I put this ratchet assembly onto the rotating extender bar, I like to have the crank handle out over the patient's head and the cable and snap clip over the incision. So we'll go ahead and slide that onto the rotating extender bar, again finding the optimum position for the surgeon, and then tighten your lock knob down into a detent or hole on the rotating extender bar. When you tighten your lock knob into a detent on either the top post or the extender bar, when it's tightened all the way down, you'll see a very small gap here. If you're not actually in one of the detents or holes when you tighten it, the gap will be much larger. So if you see a gap like this, you are not tightened securely into one of the detents or holes. So the gap should look like this when it's tightened properly. When you are ready to lower the snap clip down to the Thoratrak or the incision site, switch the reversing lever to the opposite side, and then you are able to lower the retractor. And begin retracting. Once you have the retractor lifted and you want to readjust, you hold the crank handle, move it a little bit in the direction it will move, and then switch the reversing lever to the opposite side. Don't let go of the handle, and go ahead and lower the sight. Your Rultract retractor is now properly set up and ready for use. I'd like to take this opportunity to thank my friends in Spain for close to a decade now of assistance and support. I hope you found this video useful. Please let me know if there's anything that I can do for you in the future.